From Dose of Health, this is Abhishek, a specialist pharmacist currently working within the NHS in the UK. The shelves were lined with empty boxes. Kiran, a pharmacist in her mid-40s, stared at the space where children's antibiotics used to be. Her phone buzzed incessantly, parents calling, pleading for help. It was December, the height of Strep A outbreak. Mothers were driving from one pharmacy to another, clutching prescriptions like lifelines, only to hear the same words: "We're out of stock." Kiran had seen shortages before, but this was different. It wasn't just antibiotics, insulin, hormone replacement therapy, ADHD medications. The list grew longer each week. And every sorry she uttered felt heavier. How did we get here? She wondered. How did the UK, a nation known for its healthcare system, find itself in a crisis where medicine, something so basic, so essential, was becoming a rare commodity? This isn't a story of one bad day in one pharmacy. It's a story of a system unraveling, where the threads of global supply chains, economic policies, and political decisions have tangled into a knot too tight to untie. Our story begins far from Kiran's pharmacy. Picture factories in China and India, where 80% of the world's raw pharmaceutical ingredients are produced. For years, these factories ran like clockwork, feeding a global supply chain that delivered life-saving drugs to millions. Then, in 2020, the pandemic struck. Borders closed, factories shuttered, shipping containers sat idle at ports. By the time the world reopened, the damage was done. A single delayed shipment of raw materials could halt production for months. Quality control issues at one plant could ripple across continents. And with so much reliance on few countries, the fragility of the system became painfully clear. Then came another blow. The war in Ukraine disrupted the supply of essential ingredients, especially for generic drugs. Ukraine and Russia were key suppliers of raw materials and manufacturing components for pharmaceuticals. With supply chains severed by the conflict, availability dwindled across Europe. Meanwhile, the war drove up global energy prices. Natural gas, essential for heating factories and producing materials, became scarce. Energy costs soared, doubling or even tripling for manufacturers. This left companies struggling to sustain production without raising prices, squeezing their margins and reducing output. And just as the global supply chain began to wobble, the UK faced a storm of its own making. When the UK left the European Union, the headlines focused on sovereignty and trade deals. But behind the political theatre, a quieter crisis was brewing. New custom checks and regulatory changes slowed the flow of medication into the country. Pharmaceutical companies, already grappling with the rising costs, found UK less attractive. Some stopped exporting here altogether. And then there were matters of drug approvals. The UK, now outside the EU's regulatory framework, found itself lagging behind. For example, groundbreaking cancer drugs like osimertinib, used for non-small cell lung cancer, and certain advanced therapies for rare diseases, faced delays in reaching UK patients while being swiftly approved in the EU. This gap meant that for companies like Novartis and Pfizer, prioritizing the UK became less appealing. especially when navigating separate regulatory hurdles. Meanwhile, some companies like Teva Pharmaceutical scaled back their supply of certain generics, citing low profit margins and complex logistics. Others, such as Sanofi, withdrew specific medications entirely from the UK market, leaving patients and providers scrambling for alternatives. But Brexit alone didn't create this crisis. The NHS, in its effort to provide affordable care, has long negotiated some of the lowest drug prices in the world. Now, on paper, this sounds like a win. But in practice, it has made UK less profitable for pharmaceutical companies. Why sell here for less when other countries pay more? And then there is the voluntary scheme for branded medicine pricing, introduced in 2019. It capped how much the NHS would pay, but it has also imposed hefty levies on companies when sales exceeded certain thresholds. For many companies, the math just didn't add up. So they scaled back supplies or left the market entirely. Meanwhile, the British pound's depreciation post-Brexit made imports even more expensive. Let me explain how this works. When the pound weakens against other currencies, the UK must spend more to purchase goods priced in stronger currencies like the euro or the dollar. The NHS was caught in a bind, struggling to balance its budget while ensuring patients received their medications. Now, back in Kiran's pharmacy, the phone calls didn't stop. Parents of sick children, diabetics running low on insulin, women unable to find HRT. Each call was a reminder that these shortages weren't just numbers on a spreadsheet. They were patients' lives. Patients were forced to switch to alternatives that didn't work as well or came with unbearable side effects. Some couldn't access treatment at all, leading to preventable complications. And for healthcare providers like Kiran, the emotional burden was immense. Pharmacists spent hours chasing suppliers, navigating red tape, and explaining the unexplainable to patients. Well, why can't you just stock more? They would ask. And Kiran would have to explain that it wasn't that simple. To address the crisis, the UK government introduced measures like serious shortage protocols, allowing pharmacists to dispense alternatives when specific drugs were unavailable. They launched an online medicine supply tool to provide real-time updates on shortages. An express freight service was set up to rush critical medication from overseas. But these are stopgaps, not solutions. Stockpiling medicines only work for so long before they expire. And without addressing the root causes, supply chain fragility, Brexit-induced barriers, and economic pressures, the cycle is bound to repeat. Kiran's story is just one of many. Behind every shortage is a patient waiting, a pharmacist searching, and a system strained under the weight of its own flaws. Fixing this requires more than quick fixes. It demands collaboration between governments, pharmaceutical companies, and healthcare providers. It requires rethinking how we value medications and the people who depend on them. Because at the heart of this story isn't just medicines, it's trust. Trust that when you walk into a pharmacy, the help you need will be there. And that is the trust worth fighting for. Thank you for listening to today's episode. If you've been affected by medication shortages or have a story to share, I want to hear from you. Let's keep this conversation going and push for the changes we all need. Until next time, stay safe, folks.